Full day to get outside and enjoy this fall weather. Thursday, September 23rd, day 25 of Ida recovery, a beautiful fall day, but there's never a good time to fall, and that's what we're talking with Dr. B, Dr. Brent Wallis, People's Health Chief Medical Officer. According to the CDC, more than 1 in 4 adults over 65 fall each year, and of those people, less than half of them tell their doctor. So in honor of Fall Prevention Awareness Week, Dr. B from People's Health is going to explain why preventing falls is an important part of maintaining your health. Good morning, Doc. How are you?
Hey, Tommy. I'm doing great. It's feeling chilly out there today.
It's nice, huh? It's gorgeous.
Yeah, much better than last week.
Amen. Why is fall prevention such an important topic?
Well, it's a very important topic, really, just because for our older adults, it's so common. People fall down quite often, and it can really be prevented. So so you really have to kind of understand how to prevent it, because about 1 out of 5 falls can actually result in a really serious injury.
Mm. So who is at risk most for falling?
So, yeah, there's a couple of groups in particular who have a little bit higher risk. So people who have weakness in their lower extremities, so in their legs, have an increased incidence, as well as people who have either foot pain or foot numbness, which comes along with diabetes. Those people can have a hard time walking, and it can cause some balance issues, which can result in falls. But the other thing to think about, too, is medications can actually cause dizziness or unsteadiness on your feet. So things like tranquilizers, sedatives, antidepressants, maybe even blood pressure medicines. And then people who have, a lot of fall hazards in their homes, so, uneven steps and clutter on the floors, even pets. You have to really watch out for cats and dogs under your feet. And then a couple of groups, in particular, people with osteoporosis or people who don't get enough vitamin D, not only have an increased risk of falls, but if they do fall down, they're more likely to have a fracture.
So if you are one of those people and you think you're at risk, should you bring it up with your doctor?
Yeah, absolutely. You should talk to your doctor about anything that concerns you, but physicians actually should be doing a fall risk assessment at least once a year when you go to see them. But if you're concerned in particular, definitely ask about it. What we'll usually do is we can talk to you about some exercises that you can do to help increase your strength, but we'll also review those medications that you're taking. There could be things that interact, in particular with maybe some prescription medicines, and then you're also taking over-the-counter medicines. So you have to really be careful about mixing those meds without your doctor knowing about it. And then, the other thing, too, we may talk to you about vitamin D. A lot of our older adults don't get outside as often, and vitamin D really comes from the sunshine. And so if you don't get enough vitamin D, that leads to problems with bone growth and bone strength. So you want to make sure you've got good, strong bones, so if you do fall, you don't fracture anything.
I would think exercise would be extremely important, because you got to make sure that the muscles are capable of doing what you want them to do. It's not about getting a beach body, and that commercial drives me crazy. It's about being able to do the things you were once able to do, right?
Yeah, definitely. I mean, exercise is really important for 2 reasons. I mean, one is that strengthening those muscles, especially your core muscles and your lower extremity muscles, really helps with balance and sometimes even flexibility. So if you stumble, you can possibly catch yourself. But then also doing weight-bearing exercises, even something simple like walking, actually increases the strength of your bones and improves your reflexes too.
What are some of the tips you can give us and share with us maybe for preventing falls?
Sure. I mean, there's a couple of things you can do. In particular, try to keep your house as clean as possible. And, that can be difficult, but clutter really can lead to having to step over things, and that's more likely to cause problems and possibly falls. Your floors are very important as well. So a lot of us have hardwood floors, which is usually better than carpeted floors because you tend to trip more on carpet. But if you do have real slick floors, you need to make sure that you've got some area rugs and that those area rugs are secured as well. And then another thing is make sure your rooms are lit very well, because if you can't see where you're going, you're more likely to trip and fall over something. And the one thing I tell older adults in particular is really, don't get up on a stool. You're increasing your risk of falls dramatically when you do that. If you get one of those grabbers that you can buy, that usually helps, or get somebody to grab something for you. And in particular, in the bathroom, be very careful. Things are wet and slippery, so you want to make sure you've got skid-proof rubber mats and maybe even grab bars if you've got trouble with balance.
A quick break, and don't even think about going up on a roof. I have not been up on my roof yet. I used to get up there with no problem, Doc, but after the replacement knees, I tried it one time. It's like, nope, we're not going to do this. So discretion is a better part of valor. We'll talk about clothing when we come back and some other elements. And what to do if you do fall. We're talking fall prevention with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, about senior health. And we'll continue the conversation momentarily. Right now, time for WWL Traffic. 8:25, Tommy Tucker back with Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. It is Fall Prevention Week, and we're trying to keep, like a forced error. You don't fall down and cause yourself all kinds of problems, or your mom or your dad. So what about clothing? Doc, can clothing cause people to fall sometime?
Yeah, definitely. And, in particular, I always talk to people about their shoes. They're called slippers for a reason. You can slip in them. And so a lot of people wear slippers or socks around the house, and that can be very dangerous, especially on hardwood floors. And so you want to make sure you've got a rubbered sole shoe that's real supportive for you. And another thing to think about, people don't always think of this, but if you wear eyeglasses, make sure you wear them. If you can't see where you're going, you're more likely to step on something that you shouldn't, and that may cause you to react and fall down. Another little tip is everybody's got a cell phone, and so keep that cell phone on you when you're moving around the house, because if you do fall down, it's a real easy way to call somebody, a loved one, and let them know what happened so they can come and help. You can get these wearable emergency alert systems as well, so you can talk to your doctor about that as well.
What about some other elements that can be a factor in causing people to fall?
Yeah, probably the biggest one, I mentioned the dizziness that some medications that can cause, so you want to talk to your doctor about that. But another thing is when it's either too hot or too cold outside, older adults have a little bit more trouble regulating their temperatures, and so that can actually cause you to get dizzy as well. You definitely want to limit alcohol consumption. If you have a fall risk or if you've fallen before, drinking alcohol is going to make it more likely that you fall again. And then, really, when you do get up from a sitting position, you want to go slow. Don't jump out of the chair. You want to kind of sit upright first and kind of slowly get up to make sure you're not dizzy so you don't fall down.
And what happens if you do fall?
Yeah, it definitely happens, and if you do, I think the obviously fractures are the worst consequence. But the other thing we see quite often is fear of falling again. And so what happens sometimes is people, after a fall, really don't get up and move around that much. That actually can lead to decreased muscle strength. And like we were talking about, that muscle strength is critical to keeping your balance. So don't let it scare you. If you fall down, there's a lot of things that you can do. Just make sure you go at your own pace. Don't go too fast. Keep working on those exercises so you can build up your confidence again.
And you mentioned osteoporosis earlier. Can you explain what that is and how you prevent it?
Yeah, definitely. Osteoporosis is really it's weak or brittle bones, and because they're weaker, they're more likely to break if you have a fall. It can be very common in older women and men, and so really what we see quite often, if people fall down and they have osteoporosis, they may break a hip or even a wrist because they're reaching out to break their fall. So you want to make sure you talk to your doctor about the strength of your bones. There's some pretty simple tests that can be done to determine if you have a problem, and we have medications you can take that can actually help. Another thing is just making sure you eat right, because getting foods with enough calcium in them, and like I mentioned, getting that vitamin D from the sunshine or even a supplement can help improve your bone strength, and keep up with those exercises.
Yeah, you got to keep lifting weights, keep those muscles strong for the bones. How do you learn more about today's topic if people want to look more into it?
we've got a lot of great information on our website at peopleshealth.com/wellness. We've got a couple of videos on there that have a lot of information, and also a home safety checklist, which is a really good way to kind of make sure your home's set up correctly to prevent falls.
Thank you, Doc. I appreciate your time. I really do, and I hope we can prevent some people from falling down. You go to peopleshealth.com/wellness, scroll down to wellness videos. You go to peopleshealth.com, call 866-687-7335, and you can follow People's Health on Facebook, Twitter, and Instagram. Doc, have a great week. Get out and enjoy this weather.
Thanks, Tommy. You too.
All right, I will. It's 8:30, time for WWL First News, and for that, we go to Dave Cohen.